If you have chronic diarrhea, you may have an unusual condition called microscopic colitis. Let's discuss what that is, who is at risk, and how it is diagnosed. Microscopic colitis is a chronic inflammatory condition of the colon. Like ulcerative colitis, it causes diarrhea, but it's typically non-bloody because unlike ulcerative colitis, the colon itself appears normal. There's no ulcers, and so when we look at it on a colonoscopy, it'll appear near normal. But with a biopsy of the colon, under the microscope, we will discover an excessive number of lymphocytes or a thickened ring of collagen. Perhaps because it does not cause ulcerations, microscopic colitis is not as uniformly painful as other inflammatory bowel diseases. But some patients can have pain, about half, and for some of those, pain is a very substantial portion of the presentation. Most patients will have a watery diarrhea occurring 5 to even 10 times a day, but I've seen patients with upwards of 20 bowel movements a day. While the diarrhea of microscopic colitis is non-bloody, such profuse watery diarrhea can irritate hemorrhoids and provoke them to bleed. Like other inflammatory bowel diseases, microscopic colitis can cause irritations of joints and of the eye. Who gets microscopic colitis? It's quite an uncommon disease, occurring in only 1 in several thousand people per year, making it an order of magnitude less common than ulcerative colitis. It's typically occurring in people who are older, with the median age being those who are 65. About 1 in 4 cases occur in people in their 40s, and I've even seen it in 20-year-olds. It predominates in women, with about 2 to 3 cases occurring in women for every man. Microscopic colitis is viewed as an autoimmune colitis and is associated with other autoimmune diseases, such as those of the thyroid or type 1 diabetes. And while it is a disease of the colon, it is associated with similar conditions that can occur in the stomach or the small bowel. Common medications contribute to microscopic colitis through an unclear mechanism. One of the most classic is non-steroidal anti-inflammatory drugs like ibuprofen. Proton pump inhibitors like omeprazole, acid-lowering medicines that we commonly use in GI are another culprit. So are cholesterol-lowering statins and antidepressants of the serotonin reuptake inhibitor class. Proportionally, very few people who take these medications will develop microscopic colitis. So if you are using these medications and you develop diarrhea, don't jump to the conclusion that you have microscopic colitis. Please wait for the formal diagnosis, and certainly don't stop a medication that's important like an antidepressant abruptly. It's really important that you go to a doctor and you're evaluated. One more culprit cause of microscopic colitis is tobacco, and so if you're using it and you have diarrhea, take this as one more reason to quit. How is microscopic colitis diagnosed? Patients usually arrive at a GI clinic having suffered months of unrelenting diarrhea. At times, microscopic colitis can occur in stretches, though usually these last for weeks at a time. Labs are useful to exclude infections that can cause diarrhea, and it's especially important to exclude Clostridium difficile as a cause. Parasites at times can cause these kind of chronic diarrheas, but in the developed world, those are so uncommon that unless you have specific risk factors to have a parasite, it's not a very useful test. It is important to exclude celiac disease because it can present very similar. Basic labs are also useful to uncover any electrolyte disturbances that can occur with diarrhea, anemia, or any protein loss that may result. Ultimately, the diagnosis is made by a colonoscopy with biopsies, and it is a diagnosis made by the microscope and a pathologist more than it is by a GI doctor, because the endoscopic appearance on the colonoscopy is typically completely normal, and it's only by seeing the increased number of lymphocytes in the colon biopsies or a thickened collagen ring that we can actually diagnose a person as having microscopic colitis. I hope this video has been helpful to give you an introduction to microscopic colitis, its causes, and how it's diagnosed. In a future video, we'll discuss how it's treated. So please subscribe to the channel. Thank you for watching and be safe.